Hello, my name is Dr. John Regan and I am the lead obstetrician in charge of the OPAL team at Monash Medical Centre, Clayton. The OPAL team specialises in looking after women whose pregnancies are complicated with diabetes. You're most likely watching this presentation either because you've been diagnosed with gestational diabetes or because you may have an interest in this area. Gestational diabetes, which we also call GDM, is defined as diabetes which occurs in pregnancy and which is not present when the pregnancy is finished. It occurs because the hormones which are helping to grow your baby oppose the action of insulin, which is the hormone responsible for lowering blood sugar levels. Because of this, pregnant women need to produce more insulin to overcome this resistance. While most women can do this, some cannot, and it is this group who may develop gestational diabetes. Gestational diabetes is a completely different condition to pre-existing diabetes, and the two conditions should not be confused. Very few women diagnosed with gestational diabetes will experience any symptoms or signs of the condition. Increased thirst and urinary frequency are very common conditions of pregnancy and not a sign you may have gestational diabetes. We recommend that all pregnant women have a test for GDM. This test consists of a fasting 2-hour test where you're given a glucose drink and then have a blood test performed, initially at 1 hour and at 2 hours after the drink. Gestational diabetes is diagnosed if these results are abnormal. We generally recommend this test is performed around 26 to 28 weeks gestation in most women. Your doctor or midwife may suggest the test is done earlier if you've had gestational diabetes in the past or any other history or factor which may increase your likelihood of being diagnosed with gestational diabetes. If the test is abnormal and you are diagnosed with gestational diabetes, we will refer you to a diabetes educator who will teach you how to monitor your blood sugars, which we also call BSLs. This is done by pricking the end of your finger to get a small sample of blood onto a test strip. You then put the test strip into a machine called a glucometer, which tells us your blood sugar levels. We will want you to do this 4 times a day, first thing in the morning prior to eating, and then an hour and a half after each meal. We will ask you to record these readings in a book, which will be given to you. Your blood sugar levels will vary depending on your diet and level of activity. We may need to review your diet and encourage you to do more exercise so that your blood sugar levels can be kept in the normal range. For most women, this is all that will be needed. Some women will continue to have high blood sugar levels even if they've changed their diet and their level of activity. These women may need to be given insulin to bring their blood sugar levels back to a normal range. This is important as high blood sugar levels can have an impact upon your body and upon your baby. So it is really important to monitor and try and keep your blood sugar levels in the normal range. Provided the BSL levels are normal, most women diagnosed with gestational diabetes will not need any change to the type of care they are receiving and will not need antenatal CTG monitoring or induction of labour unless there are other indications for this. After the birth of your baby, we will want to monitor your baby's blood sugar levels in the first 24 hours of their life. If these are normal, we do not need to do anything further. But if they are low, we may need to give your baby a little bit of extra milk, such as some of your own expressed breast milk or occasionally some formula. After giving birth, the hormones that have caused you to have gestational diabetes will go, and your blood sugar levels will rapidly return to a normal range. We may still ask you to do some blood sugar levels while you're in hospital to check that they have returned to a normal level. The early diagnosis and treatment of diabetes is very important, and some women diagnosed with gestational diabetes will develop diabetes later in life. And so we'd recommend follow-up with your GP following the birth of your baby, and then subsequently every 2 years to ensure you do not become diabetic later in life.